A very good afternoon, one and all. It's 14th November today, and wishing all the cute children out there a very, very, very happy Children's Day. Wishing you all abundance of health and happiness always. On this special day, I would like to grab this opportunity and throw some light on the commonly found childhood psychiatric issues which unfortunately are on the rise in today's times. Now, before I move into the disorder part, I would like you all to understand the concept of childhood, or when we all think or visualize an idealistic child or a childhood, a very bubbly, rosy, and cute picture comes to all our minds. But when you look around today, you would hear a lot of parents complaining that my child does not listen to me, is so stubborn, he or she is a tough nut to crack, and it's just difficult, it's getting difficult day by day to deal with my child. He or she does not play with the kids around, is constantly glued on his phone, is constantly demanding for new things, refusing to study, getting low marks, not studying, not showing interest in anything, not maintaining an eye contact, is emotionally very cold, and the list goes on and on and on and on. But what I see, unfortunately, is beyond all these list of complaints is that parents tend to come to a label or a conclusion, like my child has ADHD, my child has autism, my child is a bad child or a tough child or abnormal child. We see there is haste in putting labels. We see there is directly a line of conclusion of good or bad, normal or abnormal, or a particular diagnosis in general. But what we need to understand or contemplate here is it's not about a conclusion, or it's not about drawing a label that yes, this is bad or this is good, or this is ideal and this is not ideal. Beyond these labels or these demarcations is we need to look at the why this particular behavior is stemming from. There is some root cause somewhere which is causing this. And when we see at the range of psychiatric disorders currently seen among children, the list is way beyond one can expect. Right from neurodevelopmental disorders, which has issues like autism spectrum disorders, where a child has low emotional reciprocation, is communicative capacity is low, tends to have behavioral issues like self-harm or impulsive behavior, or tends to be very socially withdrawn and not interacting with his peers. Then there is intellectual disability, where the patient or the child might not have the intellectual capacity expected or the social capacity expected for that particular age. Then there is specific learning disorders like dyslexia, dysgraphia, dyscalculia, which was also portrayed very beautifully in the movie Tare Zameen Par. Then there are childhood movement disorders like tic disorders, which was again portrayed very well in the movie Hichki by Rani Mukherjee. Then we have communication disorders, where the child intellectually is doing okay, socially is lagging behind because of his or her communicative issues like stuttering, stammering, or language disorder in general. So all these are examples of neurodevelopmental disorders wherein there is some issue which has happened during the formative or the developmental years of the brain, which has impacted or translated into behavioral issues of various kinds. Now, apart from the neurodevelopmental disorders, we see a wide range of psychiatric disorders which are also seen in adults among children. The only difference is children might not present the way an adult would present with the same disorders. Like Depression in children need not be crying or loss of interest or death wishes or being withdrawn or not interacting with others. It can be a lot of anger issues, irritability, school refusal, and etc. So basically, children do not have the capacity to articulate their feelings like adults. So the way they present could be in forms which are very contrasting to adults, like anger issues or being destructive or being irritable can be a sign of depression in children, which is a little unlike in adults. Now, apart from depression, we also see anxiety disorders, panic disorders, and OCD, which are also commonly found among children but tend to go unnoticed because parents tend to believe like ये तो ऐसा ही है या ये तो ऐसी ही है, this is just a part of childhood, it will resolve, ठीक हो जाएगा, let's give it some time, or it's just a plain teenage tantrum. But unfortunately, if we leave a lot of these things untreated, they amount to very, very severe psychological impacts in the future. Now, another very common problem stemming in today's world among children is the use of phone, online gaming, exposure to adult or age inappropriate content among children, and also substance use, which we see unfortunately in today's time even in children as small as in 7th or 8th grade. The sole reason here being early and unsupervised exposure to social media or content on television around them, which is not being monitored by their parents or not being regulated or thought about or spoken in schools. We also see that a lot of these issues or psychological issues are secondary to some kind of trauma, like a child sexual abuse or a loss of a close family member, or witnessing a disaster or a major psychologically impacting event in their life, which translates to different psychiatric disorders in childhood. Why I am throwing a light or why I am focusing on these particular disorders today is we as adults or we as responsible citizens of this country need to understand and look beyond the labels society is forcing us to put on children, and we need to address these in a more empathetic, in a more understanding manner, because when we lay a good foundation for the children today, we are giving them the space to develop into psychologically and emotionally healthy adults. And it is our responsibility as adults today to nurture these children who are going to be the future of mankind tomorrow. So please, if you have anyone in your circle or anyone you know, or if you have a child at home suffering from these issues, it is my sincere request to please take them to a mental health professional for a detailed evaluation and push them for treatment at the earliest, because a lot of these issues can be addressed in a more empathetic manner, which can benefit the child and the parents at the same time. So again, stay happy, stay healthy, and seek help when needed.